We had a child who was a bone marrow transplant recipient. She was 15 years old. She was very quiet, withdrawn. Family was there sometimes, not always. Mom had to work. They had to kind of take care of themselves and their resources as well while their daughter was admitted. One day the child life specialist set up a schedule so that this child could be visited by different members of the interdisciplinary team. It would provide some predictability for her because she was admitted for a very, very long time. The bone marrow transplant gave a lot of difficulties for her, and eventually she did die of that disease. She had asked when I was there as the chaplain to hear a story. So I told her a godly play story, which is a kind of intervention that we use. And as the story goes on, there are a lot of open-ended wondering questions. So as we wondered, she remained pretty silent throughout. It's hard to tell exactly what's going on, and so looking for specific responses doesn't always indicate what's happening inside of a person spiritually. The next time I saw her, she said she was really interested in hearing stories about saints. So I found a book that had stories of saints and brought it to her. As we talked, she was somewhat familiar with Catholicism, and she thought she had been baptized Catholic, but she wasn't sure. But she continued to ask about saints and wanted to hear more and more of them. So I finally gave her the book after we had read through it. As she began to decline, she was transferred up to the ICU, and she had asked if she could receive all of the sacraments. That included baptism, which we had determined she actually had received, and her mom was able to confirm that for us. But she also wanted First Communion, and she wanted to be confirmed into the Catholic Church. We went to the NICU and took a christening gown. And one of my colleagues helped take the lace off of it so we could create a baptismal or a First Communion veil for this 15-year-old. And then I had a priest come in who was able to be there. The whole team gathered around, her mom, her dad, the psychologist, the fellow, the attending, the social worker, all the people who have cared for her throughout the many months of her admission. And then in the ICU room, she was given these two sacraments that seemed to mean so much to her. Despite her quiet notions, despite her minimal communication, she was a very quiet girl. This was so meaningful for her. We all took pictures with her. She had us all pose at the bedside after she received these sacraments, and it seemed to really fill her. She was glowing and smiling. And it looked like she was uncomfortable, so I asked if she wanted to remove the sort of makeshift First Communion veil, and she said absolutely not. She wanted to keep it on. So we were all very happy and honored to be part of that sacred journey with her. And it was the following day that she actually died. And while I don't know exactly how that affected her in terms of the course of her treatment and ultimately her death, I do feel as though we provided something very, very important for her, something that was incredibly meaningful for her. And through that, she was able to provide pictures and memories to her family, who also found deep comfort in the fact that she had received these sacraments, that she had really accepted her own sense of spirituality really very much on her own. She had asked for it specifically. And I think that provided a measure of comfort to the parents as well as the care team, who was able to all be there in the room with her and really find comfort in that as well. So it was a really great example of not only a person, but even a child, an adolescent, asking for spiritual resources that were important to her, about providing them and exploring them, about doing what it is that we need to do through resourcefulness to make those sacraments and spiritual resources available to her, and ultimately about what that meant to the patient, to her family, and to the care team as a whole.